everyone, and welcome to today's webinar on the Healthcare Cost Institute's 2017 Healthcare Cost and Utilization Report. Before we get started, we'd like to go over a few items so you know how to participate in today's event. If you are in the presentation using your computer speaker system, you will hear audio through your computer speaker. If you'd prefer to join over the phone, select phone in the audio pane on your attendee control panel to the right of your screen, and the dial-in information will be displayed. If you're using the phone option, please enter your PIN number displayed on the screen. You will have the opportunity to submit text questions by typing your question into the question pane of the control panel on the right side of your screen. You may send your questions in at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. Today's webinar is being recorded. A link to the recording will be made available on the HCCI website in the coming days. I would now like to introduce today's presenters. With us today, we have Niall Brennan, CEO and President of HCCI, Jeannie Fogelson-Bennett, Senior Researcher at HCCI and one of the authors of this year's Healthcare Cost and Utilization Report, and John Hargraves, Senior Researcher at HCCI and another author of this year's report. I'd now like to turn the call over to Niall.
Good morning, everybody. Thank you for joining us. We're really happy that so many of you have dialed into the webinar. I just have a few very brief introductory remarks before handing it over to John and Jeannie. I think, this is a really important population for all the attention, the rightful attention that is focused on public programs like Medicare and Medicaid. Always keep in mind that the vast majority of Americans continue to get their coverage through employers. And so in our latest report that covers healthcare spending in this population through 2017, spending is continuing to grow at rates that really should continue to cause concern. Spending in 2017 was 4.2%, which was down slightly from 4.9% in 2016, but still faster than the growth in overall GDP. If you want to put a dollar number on that, spending per enrollee has now reached $5,641. The reason for this rising spending, it's not utilization. Utilization is mostly flat or declining for this population. It is mostly prices, as we and other researchers have found. And finally, and John and Jeannie will get into more detail on this, I think one of the real value adds of this report is that we're not just providing top-line numbers. We provide a lot of granular detail across multiple types of service: inpatient, outpatient, professional, and prescription drugs. And you will see that spending and spending trends are really diverse. Just because healthcare spending is going up overall does not actually mean that all types of healthcare spending are increasing. Also want to flag that in addition to the report, we have a whole series of tables available for download in machine-readable format for you guys to play with and use yourselves. And this year we added a really nice interactive tool looking at spending trends at the state level. So with that, I would like to thank John and Jeannie for all their hard work on this project and turn over the rest of the presentation to them.
Thanks, Niall. I will start by giving some high-level overview of our findings and then turn it over to John to dive deeper into the spending, utilization, and price trends by service category. So as Niall mentioned, our top-line finding is that healthcare spending continued to grow, climbing to $5,641 per person in 2017. As we note throughout the report, our spending estimates do not reflect the drug rebates for prescription drugs. However, they do include discounts from the wholesale price, so this is something to keep in mind. The rise in spending represents a 4.2% increase from 2016 to 2017, and although that is slightly lower than the 4.9% observed in 2016, it is the second consecutive year that we're seeing growth above 4%. Overall, use of healthcare has changed very little Rather, prices are continuing to increase. Across the board, prices drove spending growth, and the average price increase was 3.6% in 2017. We would note that is a slower pace than earlier in the 5-year period, and this deceleration in price growth is really what explains the slight slowdown in the last year. Finally, we also look at out-of-pocket spending, and we find that people are spending more each year out of pocket. However, the increase was a little bit slower than the rise in total healthcare spending, so out-of-pocket costs comprised a smaller share of spending in 2017. Before I jump into the per-person spending trends, I did want to note some methods updates that we did this year, just to keep in mind as I present these results. So this year, we adjusted our prices and utilization to account for year-to-year changes in the service mix intensity of the 3 of the 4 service categories, the exception being prescription drugs. So that means the prices we present factor out changes in the intensity of services provided in each category, and correspondingly, the utilization captures both volume changes and changes in the intensity of services provided. This is important because it allows us to better distinguish increases in average prices for the same services versus changes in the mix of services. There are more details online in our methodology document for folks that are interested in learning more. So as you can see on this chart, or on this slide, we look at 4 high-level service categories: inpatient spending in red, outpatient in yellow, professional services in blue, and prescription drugs in green. In total, spending on these 4 categories was $5,641 in 2017. The largest component of spending was professional services. Those are things such as office visits, and it accounted for nearly 1/3 of spending. I will note, though, that we saw increases in each category in each year over the period. On this slide, we have the cumulative changes since 2013 in utilization, average price, and spending. Over the 5-year period, the cumulative increase in per-person spending was 16.7%, which you can see on the black line on the right panel. That is an average annual increase of 3.9%. And to put that into perspective, per capita GDP grew an average of 3.1% over the same period. So healthcare spending is growing faster than per capita GDP. Increases in spending can arise from increases in use, increases in average prices, or a combination of both. The change in the composition of services can also affect spending. After adjusting for changes in the mix of services, we see that prices do drive per-person spending growth. The solid lines on the left panel show the cumulative change in 2013 for average prices for each of the service categories, as well as overall. And the dashed lines show the cumulative change in utilization. As you can see, utilization is pretty flat overall, declining for inpatient admissions and increasing a little bit in that last year for prescription drugs. Across the board, prices were also rising. Looking at the same information, but on a year-to-year basis, we see how growth in spending, utilization, and average prices varied between 2013 and 2017 across the different service categories. So these figures show those annual changes in total on the left, and then for each service category. Looking first at utilization, which is, again, are the dashed lines in each of the figures, we see trends varied across the service categories. Inpatient admissions declined between 2% and 4% in 2014 and 2015 before leveling off. Outpatient facility visits and procedures and professional services also saw declines in utilization in the beginning of the period, and then some mostly offsetting increases toward the end. And the number of prescription filled days covered by a prescription drug was relatively flat until the last year when it increased 3.3% in 2017. As for average prices, there was some moderation overall, but again, trends varied by service categories. And again, these are the solid lines in the figures. Average prices for inpatient admissions saw their lowest growth over the 5-year period, increasing 3% in 2017. Outpatient prices grew 5.7%, the highest year-over-year growth in the period for that category. And professional services also saw their highest growth in the period in 2017 at 3.5%. Finally, the point of sale prices for prescription drugs saw the lowest annual growth rate in the most recent year, increasing just 1.4%. This year, we have also included information on the commercially insured population. First, we look at spending per person by age group. Not surprisingly, the youngest group had the lowest spending, and the oldest group had the highest spending. Those numbers in 2017 are in the figure on the left. We also looked at how spending varied for individuals diagnosed with one of 5 chronic conditions. Those include hypertension, asthma, diabetes, attention deficit hyperactivity disorder, and congestive heart failure. Average spending for individuals with one of those 5 conditions was about $8,900 in 2017, compared to just $3,600 for people with none of these conditions. Those with 2 or more had even higher spending. And then our last top line finding, looking at out-of-pocket spending, as I mentioned earlier, total out-of-pocket spending continued to rise each year, increasing a total of 12.2% over 2013 to 2017. That growth was lower than total per person spending, however. So while the nominal out-of-pocket amount paid by patients increased, the share of spending paid out-of-pocket actually declined slightly. And now I will turn it over to John to go into a bit more detail on each of the 4 service categories.
Hi, this is John Hargrave. So touching on one of the points that Niall made, we see a lot of variation in the spending growth when we look below the total number and below even the subcategory annual growth. So this chart gives you an idea of that variation. With that 4.2% annual growth from 2016 to 2017 as the dashed line. And you can sort of see that all these subservice categories have different growth rates in spending. Some go down quite a bit while others go up. And the same sort of annual variation, will change year by year. So this is kind of one of those important concepts of having an annual report and looking at these trends is to, figure out what's going on in the latest year of data. So we'll get into what are some of these categories that are moving quite a bit. First up, inpatient spending. As Jeannie mentioned, overall we saw utilization decline for inpatient services. It was down 5% over 5 years. Spending, though, increased 10%, so we do see this price growth of 16%. When looking at the subcategories underlying that total number, we see that surgical and medical admissions were kind of the driving factor in terms of declining use. And those 2 categories make up the lion's share of spending on inpatient admissions for this population. Labor, delivery, newborns, the utilization actually increased, and mental health and substance use saw an increase in use, as well as an increase in price, which kind of totaled to the highest growth in spending of any of our inpatient subcategories. For outpatient, we kind of looked at, we split outpatient services into 2 categories, one being visits, which include outpatient surgery, ER, observation, and ambulance, and the other being procedures, which radiology, lab pathology, and DME. All of our outpatient category is outpatient facility claims, and one thing. So with the visits category, that's where we saw the large growth in prices, which contributed to the spending increase we saw overall. And these are actually your higher per price services, mainly being outpatient surgery and ER. ER is a category that we took note of based on the fact that utilization and prices both increased over the 5-year period, culminating in a 36% increase in spending. On the procedure side, we saw overall spending growth of 15%, which is lower than the growth in the outpatient visits. And we also saw some interesting trends. And one thing I'd like to point out, specifically with radiology, and this is sort of a limitation of looking at 5 years of data, coding changes happen. They are hard to capture or adjust for. And in 2017, there was a major coding change in radiology, specifically mammograms, where 5 codes got collapsed down to 3 new ones, which of course looks like use drops and price goes up. But that is a coding change and is noted throughout the report. But that's just one of those things to keep in mind. Coding changes happen. We have adjusted for changes in intensity, mix of services, but brand new codes do pop up, and we try our best to point them out when we are aware of them. Professional services. So this is the largest category of spending and includes most services provided by a provider in an office setting. Office visits are the largest category of spending. They had relatively flat use with slight increase, 2%, with steady price and spending growth. The one category that kind of stands out as far as increased spending, it was administered drugs. So we saw spending on administered drugs increased 45%, while use declined 12%. Another category we found interesting this year is the psychiatry category, which saw a pretty large increase in utilization, 18%. And so that category, utilization was actually driving spending growth rather than price, which kind of goes back to the story with inpatient mental health and substance use. So it does seem to be that services related to mental health and substance use treatment have been increasingly utilized over this 5-year period. And for the last category, prescription drugs. As Jeannie mentioned, our prescription drug spending is based on point-of-sale prices and does not include rebates. Overall, use of prescription drugs was flat throughout the period until 2017, where we saw an annual increase of 3.3%. And we actually saw prescription drug price growth decline in that year. So if prescription prices increased 1.4% between 2016 and 2017, which is the smallest annual growth of any of the high-level categories. Part of that price slowdown can be attributed to some blockbuster patent expirations and the switch from brand name drugs to generics within some of the higher utilization categories, such as cardiovascular and central nervous system drugs, both of which also saw increased utilization between 2016 and 2017. Hormones was another category where we saw utilization increase in 2017, and that utilization increase was partly due to increased use of contraceptives. So I know this is a lot of detail to throw out there, so I do want to make it clear that the report is available online with all the charts shown in this slideshow. We also have all the data available for download. I'm sure there are data nerds on the call, so if you want to dive in, there's more detail in the tables and the downloadable files that we didn't get a chance to present here in the report, and we are happy to make that publicly available for your use. And we have an interactive state-level data tool, which highlights sort of the variation in spending and all the high-level spending categories by state and the growth and drivers of that spending in each state. So, our final takeaway from this year's annual report is that people are spending more, and it's because prices are rising. But that leads to the broader question of what are those higher costs buying us? I think we are ready to open it up for questions.
Thank you. We are now going to begin answering the questions submitted during today's presentation. As a reminder, you can still submit questions through the questions pane in your attendee control panel on your screen. So I think the first question is, what is behind some of that high out-of-patient cost growth that we saw? What is behind some of that high outpatient growth?
Just like that.
So I think one thing that John pointed out was the ER visits. So this is an instance where both utilization and prices are increasing, and when we see both of those happening, the total spending growth accelerates. So that is a large one. The other large category there is outpatient surgeries. Utilization there was declining, but the average price for an outpatient surgical visit was increasing over that period.
Yeah, and those two categories make up 60% of the outpatient spending. So when we have spending growth in outpatient surgery and ER visits, that's going to really drive that whole category of spending.
Great. And can you talk about the difference in ER growth from the professional services category compared to the outpatient services?
Yeah, sure. So the outpatient category is based on facility claims, whereas our professional services are the claims submitted by providers and physicians who are not billing under a facility. So the ER outpatient is typically what you think of as an ER visit. It's the claims submitted from the hospital or ER department, whereas the professional procedures ER category is the services that providers performed and billed for that occurred in an ER. We saw faster growth in the facility outpatient ER category, but the trends were similar, with price and use both increasing over the 5-year period.
And considering the rise of spending, are there any bright spots to the 2017 data?
I think that the increased utilization of generic drugs, which we saw that for the most popular categories as well as overall.
Okay. And can you give us a high-level overview of the representative data set that generated the reports? So people may not be familiar with the HCCI's comprehensive data set there, but the combination that this is really an employer-sponsored insurance.
So our data come from 4 of the largest health insurers: Aetna, Humana, United, and Kaiser Permanente. We have claims for about 40 million people per year, which is just over a quarter of the people who receive health insurance through an employer. And that includes both people who are employed by the sponsoring employer as well as their dependents. So you'll notice that a quarter of our population, or of the employer-sponsored population, is 18 and under. So these are people who are working as well as their spouses and their kids. And these are the claims that are submitted on their behalf, which is about 4 billion claim lines.
And along that line for your methodology, how does HCCI measure the spending and utilization in areas with some of those less data?
So they're all weighted using the American Community Survey weights based on age group, geography, and gender to reweight the sample of those 40 million individuals to represent the I think it's just under 200 million people that have employer-sponsored insurance, about 170. So,
great. And you mentioned the mental health and substance abuse category. Talk a little bit more about what you're seeing in that trend.
Yeah, sure. So the mental health and substance use inpatient admissions category, we saw, and actually in the report, we do split out mental health and substance use admissions to look at the trends separately. Both of those saw increases in use, particularly in 2017, increases in price and total spending. For the substance use admissions, utilization increased 18% over the 5 years. Correspondingly, the price increased 39% for substance use admissions over that 5 years, resulting in spending increases of 64%. So large increase in spending on substance use admissions, but it was, overall a small portion of inpatient spending was spent on mental health and substance use, about 4%. So that 64% increase, while though large, is not going to be driving a lot of total inpatient trends and
Okay.
Yep. Sorry.
Okay. So you noted the price is the key driver of overall cost increases. Any insights on what is driving those prices?
So that's not something that we get into in our report. There is a large literature of research that does look at healthcare prices. And unfortunately, it's not something we speak to directly in this report.
I mean, I think to build on Jeannie's comment a little, there is a large literature. There's been a lot of consolidation and merger activity on the hospital side of the industry, which most are, frankly, all research, including a piece just yesterday in the New York Times by Austin Fract seems to have concluded that these have price increasing effects. I think other types of consolidation, including the acquisition of physician practices by hospital systems, and obviously there is I would say a broad-based concern with prescription drug pricing right now, both in terms of launch prices for new drugs. Of course, new drugs may be potentially innovative and life-saving, so we can't discount that, but there seems to be a lot of concern over really high launch prices and then increases in prices on existing drugs. So anybody who's been paying any attention to the new Congress, it seems to be of acute interest to both chambers and the executive branch.
Okay. And there are a couple questions coming through on the data set that specifically is used in this report. Can one of you reiterate that?
Yes, so why don't I just clarify? I mean, at its simplest, I mean, this is sponsored data. So this is not individual market data. It's not Medicare data. It's not Medicaid data. This is a little, as Jeannie said, a little over 40 million people who have, I guess I would describe them as fully insured or ASO products through their employers. So we believe this is a very representative data set of healthcare experience for working Americans and their families. That's really why this HCCI resource has been so unique over the years. Prior to the formation of HCCI, it was difficult, if not impossible, to aggregate this much employer-sponsored coverage data in a single place.
So this also will note that we don't have data on premiums that individuals pay for this coverage. So it doesn't necessarily reflect the full burden on consumers. The Family Foundation and Health Research and Educational Trust do an annual survey where they look at premiums, and they found over the same period covering our report that premiums for employer-sponsored plans grew 14% for single coverage and 15% for family coverage.
I also see that there's a question there regarding plan types, and if we analyze differences between PPOs and high deductible health plans specifically for this report, we have not, but there is both prior and pending research by HCCI that will look at this issue. Certainly the prior research did discover that enrollees in high deductible health plans utilized less healthcare overall than their contemporaries in other products.
There's a couple questions about out-of-pocket spending. Can we clarify some of the key points there?
Yeah, so out-of-pocket spending includes the payments paid by the patients themselves at the point of service for healthcare or prescription drugs. So these are your co-pays, co-insurance, and made towards a deductible. Those, so the nominal amount, so the actual dollars that people paid increased over the period of time. Total spending was rising faster, and so they account for a smaller share of total spending. Which is we thought an interesting trend, and while we can't dig into the details too much, we do provide some context in the report. Over this period, out-of-pocket maximums became almost universal among employer-sponsored plans, so that could provide some upper limit on out-of-pocket costs and may explain why they're not growing as fast as total spending.
Great, thank you. And if you do have a question, please submit them through the control panel. Any that we do not have time to address today, we will be addressing in writing over the next couple of days.
We also try and be pretty responsive on Twitter, so if new questions spring to mind, you can also try that wonderful medium as well.
I see there's another question about the age groups that are included in our data. So we limit the sample is limited to those under the age of 65. So even if somebody is covered by employer-sponsored insurance because they're still working past the age of 65, those individuals are not included in this report.
And lastly, can you talk to a little bit how you want this data to be used?
So again, this is a unique data resource. I think our healthcare system is complex and huge and getting bigger and more complex by the day. I think that despite multiple efforts over many years, particularly beginning with the Affordable Care Act and the launch of a lot of value-based care programs, any progress we've seen on the public side does not seem to be reflected on the private side, or if it's being reflected, it's certainly not being reflected enough with plus 4% yearly growth rates. This is an issue that is affecting every American employer and every American worker, and I think we need to broaden our national conversation about how we intend to address those challenges.
So we have a question just about minimal usage groups that might be balancing out some of those high cost chronic spenders that we have, average spending of about $5,000 per person. So in our report this year, and it's one of the new charts we've added, is looking at the percent of people within this ESI population that had no healthcare utilization in 2017. This is commonly in the industry called non-utilizers. These are people who did not essentially have any claims filed for the year. And we saw 25.5% of our population have no healthcare use. Now, they may have used services outside of their insurance, but of course they do occur in the denominator and kind of balance out the high cost of the top spenders within this population, which we have done previous work looking at the highest spenders, which is about 5% of the population that do make up a large part of the spending.
Okay. That wraps it up for our Q&A period. Niall, any final thoughts?
Just once again, thanks to the team for producing what I think is a very fascinating and compelling series of results and visuals, and thank you all for joining us on this call today.
Okay. And just to reiterate, the report and its data tables are available at healthcostinstitute.org/research/annual report. This concludes today's webinar, and on behalf of Healthcare Cost Institute, thank you for joining us and have a great day.